Today I want to talk with you a little bit about testosterone and the pros and cons of how to elevate it when it's depleted. So there are several different ways that we can actually increase testosterone for people, getting their diet right, combination of the right minerals like zinc, and then also it can be boosted by something called HCG. These are injections that people do. It basically stimulates the body to produce more testosterone. It's used predominantly in younger people in their 40s potentially, maybe their early 50s. And then there's Clomid. Clomid basically signals the body another way, through another mechanism, to actually produce more testosterone. We've had some good success for that. Again, this works well in a younger population, typically 40s, 50s. And then for people where their Leydig cells are just not producing testosterone, the solution we have at this juncture is to give them testosterone either topically in a cream or with an injection. So what are the pros and cons of the cream versus the injection? Well, the cream typically gets applied in the groin area. It works better if the area is shaved. You have to be very careful not to contaminate your partner, or you need to wash your hands after you apply it, because if you're around any children or young children, male or female, or around any females of any age, you can increase their testosterone levels inadvertently. Also, if you're sleeping with a woman and you apply the testosterone before you go to bed, then the testosterone can evaporate into the air and be absorbed through her skin, and now you're elevating her testosterone levels just sort of inadvertently again. So the cream needs to be applied twice a day to a shaved area, typically in the morning just before you go to work, maybe when you come home around dinner time, so that 2 or 3 hours pass before you're going to have any physical contact or share a bed with someone. The injections are twice a week. The downside of the injections, you have to inject yourself. The needle's a 25 gauge. It's not terribly large. It's not terribly painful. We're not putting it into the muscle so much anymore, but going subdermal. That seems to work very well. Testosterone cypionate is not technically as bioidentical as the topical, so there's a little bit of a push there. Testosterone cypionate does increase red blood cell counts more than topical does. And it also can be dosed in different patterns. So some people will dose it once a month, but we feel like that's way too high, then way too low. We think twice a week is kind of ideal. So I think no matter how you get the testosterone, it's still important to manage the metabolites to decrease risk of prostate cancer, etc. But those are the pros and cons. I think for people that spend a lot of time around kids or sleeping with a partner, the injections seem to be just cleaner and safer. If you're single and living alone and whatever else, the cream is a great option as well. So.